Welcome, nursey friends. Today we're diving into the ADPIE nursing process in pediatric nutrition. Assessment, diagnosis, planning, implementation, and evaluation. We'll break it down step by step, covering what you need to know to master your nursing exam. Remember, yes, you can do this. Let's go. 1. In the ADPIE nursing process, A is for the nursing assessment. Pediatric nutrition assessment begins with screening for dietary intake and tracking growth using standardized charts. The World Health Organization and CDC growth charts help identify trends over time. Physical signs of malnutrition include brittle hair, thinning nails, pale or sallow skin, and poor oral health. Socioeconomic factors also impact nutrition. Food deserts, low-income barriers to healthy meals, and lack of nutritional education play major roles. A child at the 5th percentile for weight and length consistently across multiple well-check visits may be diagnosed with failure to thrive, a condition requiring in-depth nutritional assessment and intervention. Okay, let's do an assessment hot shot. A nurse is evaluating an infant at a well-check visit. Which assessment finding is most concerning? A weight that remains below the 5th percentile for age, weight gain plateauing after 6 months, or a height that is in the 25th percentile? The correct answer is a weight that remains below the 5th percentile. This is an indicator of failure to thrive, which may be due to inadequate caloric intake, metabolic disorders, or feeding difficulties. 2. D is for a nursing diagnosis. In the ADPIE process, use the standardized NANDA nursing diagnoses to structure our care plan in all patient populations. Common nursing diagnoses for pediatric nutrition include imbalanced nutrition, whether it is less than body requirements or more than body requirements. Malnutrition may stem from metabolic disorders, feeding issues, or socioeconomic factors. Obesity in children is increasingly common and has long-term consequences, including metabolic syndrome and early-onset type 2 diabetes. Risk for aspiration is another concern, especially in children with cleft palates, dysphagia, or oral motor delays. Nurses should recognize signs such as coughing during feeding, recurrent pneumonia, and prolonged feeding times. Hot shot. What physical sign is most indicative of Kwashiorkor compared to Marasmus in a child diagnosed with protein-energy malnutrition? Generalized edema. Kwashiorkor presents with edema due to low serum albumin, while Marasmus is characterized by severe muscle wasting without edema. 3. The next step in the nursing process is P, or planning. Individualized care plans should include dietary modifications, education for parents, and referrals to specialists when necessary. Addressing parental knowledge gaps is key. Many caregivers are unaware of how to prepare balanced meals or recognize early signs of malnutrition. Community resources such as school meal programs, WIC, and food pantries play a vital role in ensuring access to adequate nutrition. Nurses should advocate for these services and educate families about available options. Hot shot. What is the most effective intervention to promote healthy eating habits in school-aged children? You should involve both the child and the family in meal planning and preparation. Engaging children in food choices fosters autonomy and increases the likelihood of adherence to a balanced diet. 4. I stands for implementation, which includes direct nursing interventions such as breastfeeding support, formula education, and meal planning. The choice between breastfeeding and formula can be influenced by many factors, including maternal preference, medical conditions, and social circumstances. Nurses should provide evidence-based information and support informed decision-making. Teaching families how to read nutrition labels and shop for cost-effective, nutrient-dense foods is another important intervention. Home assessments can reveal barriers to adequate nutrition, such as lack of access to a refrigerator, cooking appliances, or sufficient food storage. Encouraging a positive mealtime environment can help reduce picky eating and food aversions in young children. Hot shot. At what age should allergenic foods such as peanuts and eggs be introduced to reduce the risk of food allergies? Around 6 months of age. Early introduction of allergenic foods under guidance reduces the likelihood of developing allergies. Finally, fifth, E in ADPIE is for evaluation. Growth percentile charts and BMI calculations help track progress. Nurses should assess whether dietary interventions have resulted in appropriate weight gain, improved lab values, and better overall health. Long-term monitoring may involve collaboration with dietitians, feeding specialists, or primary care providers. Laboratory values such as prealbumin levels offer insight into long-term protein status. A child with chronic malnutrition may require additional monitoring and interventions beyond just dietary changes. Hot shot. What lab value is the most reliable indicator of long-term protein status in a malnourished child? The correct answer is prealbumin. Unlike serum albumin, which can be affected by hydration status, prealbumin is a more sensitive marker for protein status. Let's wrap up. We've covered how ADPIE applies to pediatric nutrition, from identifying deficiencies to implementing and evaluating interventions. Now let's do a final challenge with 3 NCLEX style questions. First, a 4-year-old presents with delayed growth, dental cavities, and a history of frequent infections. What deficiency should be suspected? Vitamin D and calcium deficiency. Vitamin D is crucial for calcium absorption, and deficiency can lead to poor bone development, delayed growth, and weakened enamel, increasing the risk of dental cavities. Additionally, vitamin D plays a role in immune function, and low levels can contribute to frequent infections. Other potential deficiencies include vitamin C, poor wound healing and weakened immunity, and iron, pale skin and fatigue, but vitamin D and calcium deficiency best match the triad of symptoms. Second, a nurse is educating a parent on food insecurity resources. Which community program is most appropriate for a low-income family with a toddler? WIC, Women, Infants, and Children. WIC provides nutrient-dense foods, breastfeeding support, and nutrition education to pregnant women, new mothers, and children under 5 in low-income families. While SNAP, Supplemental Nutrition Assistance Program, and local food pantries also provide food resources, WIC is specifically designed to meet the nutritional needs of young children. Third, a 10-year-old with obesity is enrolled in a weight management program. What nursing intervention will have the greatest impact on long-term success? Family-based lifestyle modifications, including structured meal planning and increased physical activity. Long-term success in pediatric weight management requires a family-centered approach that includes nutrition education, reducing sedentary behaviors, and incorporating regular physical activity. Studies show that children have better outcomes when parents model healthy eating and participate in lifestyle changes rather than when only the child is targeted. Simply advising dietary changes or focusing solely on calorie reduction does not lead to sustainable results. You've got this. Mastering pediatric nutrition will not only help you ace your exam but also improve outcomes for your future patients. More practice questions and additional learning resources are linked in the description. Subscribe and remember, yes, you can master application of the nursing process for pediatric nutrition, anatomy and physiology across the lifespan for your nursing exam.